Welcome back. September is Prostate Cancer Awareness Month. About 1 in 7 men will be diagnosed with prostate cancer during his lifetime. It can be a serious disease. Getting people aware and informed is the goal of Prostate Cancer Awareness Month. Today, we're lucky enough to have Mr. Michael Donovan of Greater Boston Urology to talk about the importance of prostate health. Thank you so much for coming in.
Oh, you're welcome. Glad to be here.
So without maybe getting too graphic, can you just give us in general what prostate cancer is?
Prostate cancer is uncontrolled growth of prostate cells. Prostate is a small gland that sits just below the bladder in men and is important for sexual function.
Are there symptoms that people could be looking out for?
With early prostate cancer, there are generally no symptoms, which is why screening is so important. With more advanced disease, you can get symptoms such as difficulty urinating, blood in the urine, bone pain, weight loss. But in general, we like to catch cancers long before they have symptoms.
So it's a difficult thing to talk about the prostate. You know, I think men are getting a little, whoa. So just tell them, how easy is the screening?
The screening is very easy. Generally, it involves doing a blood test called the PSA. We also do an examination of the prostate, which is a digital rectal examination. As far as men are often reluctant to have them done, but it is not the end of the world. And if it can save lives, it's certainly important to do.
Just how common is prostate cancer?
Prostate cancer is the second most common cancer occurring in men behind skin cancer. They're estimated about 1 in 7 men during their lifetime will get prostate cancer. About 26,000 men a year will die of prostate cancer, which is why the screening is so important. It's estimated currently there are about 2.9 million men in the U.S. living with prostate cancer.
Wow. And what are the risk factors?
The main risk factors are going to be age, race, and then family history. So prostate cancer is much more common in men over the age of 50, much less common under 50. The median age of diagnosis is around 66. As far as the racial disparity, African American men get prostate cancers, much more aggressive prostate cancers more commonly. They have about a 2.3 times increased risk of dying of prostate cancer. Family history is also very important. If you have a first-degree relative, i.e. a father or brother with prostate cancer, it almost doubles your risk of getting prostate cancer during your lifetime.
Are there things people can do to limit their risk?
They've done a number of studies on chemo prevention or prevention of prostate cancer, and to date, the only thing that they've found is an association with a high-fat Western diet. So typically, if people want to do something, we always say exercise regularly, eat healthy, and try and stay on a low-fat diet.
They say that for just about everything, don't they?
Yes, they do.
What are the common treatments?
When it comes to prostate cancer, the treatments are always going to be based on the how advanced the cancer is. So typically, when we're looking at treatments, we want to catch these cancers early when they're still localized or regional before they spread widely. As far as the cancers themselves, for more early stage cancers, in younger men, we tend to do radiation and surgery are two of the mainstays of treatment. But even with some of these cancers, because prostate cancer can be a relatively slow-growing cancer, sometimes we will actually watch them and follow them, what we call active surveillance, which is more appropriate as men get older. As far as when you get more advanced disease, then you start getting into some of the more intensive treatments where you're doing chemotherapy, androgen deprivation therapy. But those are treatments that, again, are going to be tailored towards the individual. In general, there's no single one treatment that's right for every person. It's all going to be based on their disease and their preferences.
I mean, it does sound a little scary, but the I'm going to redo that. It does sound a little scary, but the survival rates are actually pretty good.
The survival rates, if you catch it early, are excellent. So if you're looking at localized prostate cancer, the 5-year survival rate is around 100%. Even when it's not caught early, we can still keep people alive 5 years. What happens with prostate cancer is the longer you live, the more likely you're going to succumb to the cancer if it's advanced. Localized prostate cancer is curable. Once it's spread or metastasized throughout the body, it's incurable, which is, again, why we stress screening and early detection on prostate cancer.
What can people do to get more information?
There's a number of excellent websites that are out there. As far as the American Urologic Association has a website, our practice has a website, the American Cancer Society has lots of very good information. So if people are interested, I would just recommend doing just an internet search, and they'll find lots of good information about prostate cancer screening, as well as the statistics.
And what is one thing that you just want our audience to come away with?
The prostate cancer screening is important, that if you do get regular prostate cancer screening, we usually advocate that men start at age 50 with a yearly digital rectal examination and PSA. If they're in a high-risk group, family history, or African American, that they start at age 45. If they get screened regularly, that probably 85% of the time we will catch these cancers in an early, more treatable stage. If you don't screen for it, you can't find it.
Thank you so much. Prostate Cancer Foundation spokesperson is Evander Holyfield, and I loved what he said. In his words, "You can't fight what you can't see, so man up and get checked."